Welcome to Cambridge Health Alliance Health is Wealth. My name is Roberta Robinson. I'm Director of Marketing and Outreach for the Geriatric Division of the Cambridge Health Alliance, including the PACE program. Today we have Dr. Emily Chen and Dr. John Adams, and we are going to talk about a very important subject, the flu. So, Dr. Chen, do you want to start us off and talk about what the flu is and how we can keep from getting it?
Yeah, so this is definitely the time of year when the flu is most prominent as a disease that we see in our clinics and people probably see among their loved ones and friends and family. The flu, as most people probably know, is a virus, kind of in the same family as cold viruses, but it can be much more severe. So that's why we worry a lot about it and talk so much about prevention and how to stop the spread of the flu.
I mean, actually, we can have fatalities with flu, can we?
Yes.
So we definitely want to protect ourselves.
Yes.
As much we can.
The reason that we worry so much about the flu is because it does lead to more serious illnesses such as pneumonia or sepsis, which is a blood infection, and can result in hospitalization or even death far more commonly than other more milder viruses.
So symptoms?
Generally, people will have fever, often cold symptoms like runny nose or sore throat, cough, but also most prominently with the flu, in addition to the fever, body aches and often
those
headaches.
body aches, yes. That's a definite clue.
Yeah, sometimes people will say that, like, my skin hurts. And those can last for up to a week or so in someone who's otherwise healthy. And I think most people with good hydration, rest, who are otherwise healthy can usually get over the flu, but there are some warning signs that the infection is getting more serious.
Okay, and what would those be?
Talk more about. Any changes in your mental state, like confusion, if you notice your family members aren't responding to you normally, they're not able to be woken from sleep. Signs that it's become a pneumonia, so difficulty breathing, shortness of breath, especially if walking short distances causes you to have shortness of breath, and then chest pain, especially when you take a deep breath would be concerning. And the other common kind of secondary problem with the flu is dehydration. People don't drink enough, they aren't resting, so we like to see people drink lots and lots of fluids.
Now, if someone, some of the flus might be a stomach flu, right? It might not be so much a head and cold flu, but you could get, the vomiting and the diarrhea as well with flus. Can you?
We sort of use the term, like in common language, flu to mean lots of different things, a virus, but when we think about the flu from a medical standpoint, we're generally talking about the influenza virus, which is generally it is affecting more the upper respiratory area. You can get some gastrointestinal symptoms, but the more prominent symptoms are what Dr. Chen had mentioned, the runny nose, cough and cold symptoms, and then the severe high fever and severe body aches.
So if you get the intestinal things, then that would just be maybe another type of a bug?
Yeah, when people talk about the stomach flu, it's generally a different type of virus that tends to cause a lot of nausea, vomiting, diarrhea.
Right.
And the difference is important because there's a vaccine against the influenza virus, and there's also a medicine that can be used to treat influenza virus that doesn't work on the stomach flu.
And there's a test. Isn't there a test now to test whether or not you have the flu?
Yes, there is a test. There's a rapid test and a test that takes longer. both of which involve a swab inside of the nose to collect a little bit of the secretions from the nose. And that can tell us, the rapid test can tell us within a day or so whether the secretions contain influenza virus. And then the longer term test takes a few days, where they actually would grow the virus out in culture and see the exact illness. But there is a test, yeah.
So if you got results on the rapid culture, you would start treating people. And Dr. Adams, you mentioned that there was a treatment, a medicine for it now, for the flu. And the flu is a virus, right? But now there's an antiviral medicine for it, which is, we're really progressing.
Yeah, it's true. It used to be that if you had a virus, we would say all you can do is get rest and drink plenty of fluids, and which you should still do. But yes, for the flu, there is a medicine called Tamiflu, which if you take it early enough in the illness can shorten the duration of the illness, decrease how contagious you are, and decrease your risk of having serious complications of the flu, like pneumonia.
And that's a prescription.
Yes.
That's not to be confused with that, I think it's called Theraflu.
Theraflu.
That's over the market, which I think is a tea. I think it's a hot water kind of a tea.
There are a lot of over-the-counter cough and cold and even medications that are labeled for the flu. But the medicine Dr. Adams is talking about, the brand name is called Tamiflu. The generic name is oseltamivir. Are only available by prescription.
By prescription.
And I think the important thing that we think about often with that medication is that studies have shown it's only effective in decreasing the length of time that you're sick with the flu if we get it early enough to you, within 2 days of the start of your symptoms.
So that's interesting because most of us we start with maybe those symptoms and we think we might be getting a head cold.
Yeah.
Right? So now you can always be, I don't know if it really works, but in the olden days, we used to say 3 days coming, 3 days here, 3 days going.
That's good. I like that.
And so if a cold hangs on more than 3 days, then at the third day, you're starting to see some, decrease in symptoms and things like that. So you're on the mend then. And then 3 days going. You're not done with it after, but then 3 days going, right? So you're starting to feel a little bit better. So that could, things like that would definitely get in the way of getting to. So that's a good point. So when should you call your doctor? When you're, how do you know? We don't know.
I think kind of the hallmark of flu that we would want to know about right away would be fever. In an adult patient, it's pretty rare to get a what we call in medicine a true fever, which is fever of 38 degrees Celsius or 100.4 degrees Fahrenheit on a thermometer. It's rare to get that high of a fever, that true fever, with something like the common cold or kind of a usual run-of-the-mill unspecified viral illness. If you're having fever up to 38 Celsius or 100.4 degrees Fahrenheit, it's time to call the doctor.
For a day, for a couple of days, or does it matter?
I think if you have fever and body aches and this feels like more than a cold to you, I would call your doctor and at least talk to someone at the doctor's office to let them know.
Okay.
But yeah, it sort of conflicts with the usual thinking, which is like, oh, I'll ride it out. If it's hanging on, I'll let my doctor know. And unfortunately for this particular medication, that will kind of disqualify you from being able to receive any benefit from the Tamiflu.
Right, because you're beyond the point, beyond that point, right.
Yeah.
So that's interesting. We've talked about the flu, the symptoms, and treatment. Now how about prevention so that we don't get this?
Dr. Adams, did you have any thoughts on prevention?
Yeah, absolutely. So I think there's a lot of things that you can do to prevent the flu. Things like trying to avoid being exposed to the virus. So washing hands, particularly when you're out in public spaces, taking the tea, or certainly in a doctor's office, you want to make sure to be washing your hands often. If you do have the flu or any sort of viral illness, instead of coughing into your hands, coughing into your arm can prevent you from spreading those viral particles. And then, of course, there's a vaccine for the flu, which Dr. Chen, you can tell us about if you want.
Yeah, I think most people have heard of the flu vaccine.
The flu shot,
The flu
yes.
shot. And have probably, if they've interacted with a doctor at all during flu season, which is fall through early spring, have been encouraged to kind of get the flu shot.
This year, I think it was October that I heard, they started. They wanted people to have it by the end of October.
Yeah, I even got mine in September, actually, the end of September. So I think we won't, I'll try not to get into overall concerns, concerns I've heard about vaccines, but my patients have often expressed certain questions about the flu vaccine, and I think they're interesting questions, and probably questions more than just one person has. So I always encourage my patients to get the flu shot because there's really no risk to getting the vaccine, and there's such a high cost of getting the flu.
So is that patients of all ages or just your geriatric folks?
So patients aged 6 months and older are eligible for the flu shot.
Wow.
So one of the reasons that we encourage people to get flu shots is because babies 6 months and younger are not eligible to get the vaccine. So really their only protection is other people around them staying healthy. And the more that, and the same goes for small groups of other people who can't get the flu shot, who might be on
particular meds,
certain medications, or have had reactions in the past. But by and large, almost everyone can get the flu shot.
It's not the real virus that goes
It's
into us
not,
anymore,
no.
is
So
it? Because some of my folks might remember when it was the real virus. And
Yeah, so the vaccine is not the actual flu virus. So the vaccine can never give you the flu. Sometimes people will have a few days of feeling tired, their arm is sore, maybe they feel a little run down, but really that's a good sign because it means your body is using what it got from the flu vaccine to make lots of antibodies, which are your body's protection against viruses. So
well, that's good to know. Yeah.
You'll never get the flu from the flu vaccine.
You heard it here.
And so there's no risk to getting the flu vaccine. So the kind of cost, if you think about it as a cost benefit, the cost really is like $0 to your health and your body. But the risk of getting the flu, it could mean a week of feeling crummy and being off from work, or it could mean going to the hospital. It could mean getting a really severe pneumonia, and in some cases, unfortunately, it can lead to death, which we saw a lot of last year. The other interesting study that came out last year that I've been telling folks about is, and a question that comes up for me is, I got the flu shot once and I still got the flu.
Yes, I've heard that.
And the interesting study from the CDC that came out after last flu season.
CDC being?
The Centers for Disease Control, which is the body, the governmental agency in the United States that manages public health and tracks flu. They found that of the people who had to be hospitalized or died from the flu, the percentages of those severe outcomes were much lower in people who had gotten the flu shot. So it's kind of simple terms, if you get the flu shot and you still get the flu, it won't be as bad.
Okay.
And
so
you're
that's
less
good.
likely to need to go to the hospital or and less likely to die from the flu as well.
Right. Now the CDC,
Yeah.
that's this body, they do research and they come up with the particular strains that they think
Mhm.
that we might be affected by, right? And so there might be other sneaky little strains that sneak in on us, and which we're not protected against because that wasn't on the radar screen. Is that correct? And so people can get sick from those other strains. Is that correct or no?
It's true. You know, every year a new version of the flu starts somewhere in Asia and sort of washes across the world. And the CDC every year tries to make their best guess as to what are going to be the pieces that combine to form that new strain of the flu. It always provides some protection. Some years they get it right on the money and it provides a lot of protection. Other times it's not as good, but it always provides at least some protection against the flu. So it's always recommended to get the flu shot. But they have to do it that way. They have to sort of guess at it because in order to create enough vaccine to distribute it to the whole country, if they waited until they knew what the exact virus was going to be like, there wouldn't be enough time to do it.
Yeah. So it sounds like a very tricky
Yeah.
job to try to
Absolutely.
put this all together for us. But in any event, yeah, I think you're getting the message that it's better to get the flu shot than not get the flu shot. And we should get a flu shot every year. Is that correct?
Yes. Unfortunately, it still is a yearly vaccine, but they are working on kind of back in the research pipeline trying to make a flu vaccine that might be only every 5 or 10 years, like the tetanus.
That would
shot,
be
but
interesting.
That would be really nice. But
Yeah.
it's what we have right now is the yearly flu shot that does work well to protect against the flu, but is, like Dr. Adams was saying, dependent a little bit on predictions of which exact strain of the flu will be in our area
In
the
our
flu
area.
season this
And
year.
it's different for different areas. Or
It does.
pretty much.
It does vary a little bit, but in the vaccine, they provide protection against usually 3 or 4 versions of the flu.
Okay.
And so in like Hawaii, they might have a predominance of influenza B, and in Massachusetts, we currently have a predominance of influenza A. But we got the flu vaccine, the flu shot was against both. So both people in Massachusetts and in Hawaii got protection, even though their like local strains are slightly different.
Right.
So that's another question I actually got the other day for the first time from a patient was, I had the flu in December. Should I still get the flu shot? That means I don't need to get the flu shot this year.
Oh.
And I said, well, actually, I would recommend you get the flu shot because you had you had influenza A, and your body created antibodies against influenza A. Most likely, in an otherwise healthy person, will be protected for the rest of the season against influenza A. But if they come into contact with someone who coughs on them with influenza B, they will have no protection. But the flu shot provides protection against usually 3 or 4 different types. So I did tell that patient I would recommend you still get the flu shot to protect against those other versions of the flu that you didn't get in December.
Yeah. So that's very interesting.
Mhm.
So, and there are other vaccines that also we should get. Is that true?
Yeah, there are a few other vaccines that for older adults are recommended. So
Older adults
so
starting at
65 and older is the age when a lot of many of these additional vaccines are recommended. So there's basically three main vaccines that are recommended in adulthood. So the pneumonia vaccine, the shingles vaccine, and then the tetanus vaccine.
and so the tetanus is recommended every
10 years for tetanus.
Okay.
So that's even, all throughout adulthood, you should get the tetanus shot.
Okay.
And everyone should get the tetanus shot that has a component against whooping cough or pertussis. It's called the Tdap shot. It has the P on the end, which stands for pertussis. Every adult needs that once in adulthood. And then after that, tetanus shot every 10 years.
Now, 100 years ago, well, not quite 100, half 100, when my kids were born, then they had what we called a DPT, and that was diphtheria.
Pertussis.
What was the second one?
Diphtheria, tetanus, and pertussis.
Oh yeah, so it's so basically. It's
So there's similar components.
It's a modern version.
Well, there's similar components in the childhood vaccines. The way that the vaccines are constructed are slightly different.
Okay.
So for children, that's true. It's a DTaP, which does provide protection against the same organisms, but then in adulthood, it's the Tdap, and then afterwards the TD, so it's tetanus and diphtheria every 10 years.
After 10 years. And then the pneumonia, is that every year?
So no, actually. So the pneumonia shot is another very important shot to get, and it actually can, protect people against some of the complications of the flu, because like Dr. Chen was mentioning, many of the ways that when people get really sick from the flu, often it's because the flu opens the door for a serious bacterial infection like pneumonia. So there is a pneumonia shot that you can get, and it's included in the childhood immunizations. But then once you turn 65, everyone should get an additional, there's actually 2 different types of pneumonia shot, and everyone should get both types of pneumonia shot once they turn 65.
Every year?
Just once.
Just once.
So basically, to go into it in a little bit more detail, there's 2 shots. There's one that's called the Prevnar 13, and the 13 part of that is because it protects against 13 different strains of the bacteria strep.
Okay.
And that one is recommended if you haven't had any other pneumonia shots in adulthood. The day you turn 65, you should get that one, the Prevnar 13.
Okay.
There's a different pneumonia shot that's called the PCV 23, and the 23 is there because it prevents against those same 13 that was protected by the Prevnar 13 plus 10 more.
Okay.
The Prevnar 13 is a little bit better, so it's recommended that you get that one first. The immunity that's created is sort of more powerful, stronger. So when you turn 65, get that one, Prevnar 13, and then when you turn 66, get the 23. So long story short, there's 2 different ones, 13 and 23, and you need both.
Wow. Okay. Well, that's good to know. Now, a lot of older adults, but even in the younger generation, people know what this thing called shingles is. And if anyone has ever had it, it can be incredibly painful or incredibly itchy. I had the itchy version. And so now there is a shingles shot, right? But now there's a new shingles shot.
Yeah.
Right? So for those people that have had the shingles shot originally, that they can still get that new one. Is that correct?
Yeah, that's right. Yeah, the shingles can be it can range from slightly bothersome to very causing a lot of suffering, and actually can cause some prolonged symptoms. But basically, all of us or many of us get chickenpox in our younger days, and chickenpox is caused by a virus that actually can stay dormant in your body. It, for whatever reason, likes to live in a dormant state inside your nerve cells. And as you get older, what can happen is that virus can become reactivated, and it doesn't affect your whole body, but it just travels down that nerve cell to your skin and can cause the rash that you're describing, a sort of a blistery rash that can be itchy like chickenpox, or it can, because it's involving the nerve, it can cause sort of a burning sensation. Or if it's in a if it happens to be in a distribution that involves your eye, it can actually cause
Blindness?
It can cause blindness.
Yeah.
So that's particularly serious version. And for all of these, if you have an itchy rash or a burning rash on one side of your body, you should see your doctor, because there is a treatment also for shingles that can make the rash go away more quickly and can decrease your risk of having long-term complications of the rash. But to your point, there is a vaccine that can prevent you from getting shingles in the first place. And many people may be aware of Zostavax, which was the older vaccine that you got when you were 60. But there's a new vaccine. The name of it is Shingrix, and it's better. So it's, even if you got Zostavax before, even if you had shingles before, you should get Shingrix. You can get it from the day you turn 50, and it's a two-shot series. So you get one shot, and then somewhere between 2 and 6 months later, you should get the second shot, and it provides protection for the rest of your life.
For the rest of your life. Well, you know what? I don't think I got that. I think I'm going to have to check into that.
It's under severe shortage right now, so it's expected
Oh.
people may need to wait until the spring to have
I'm
access to
sure it's in demand.
It's in high demand.
I'm sure, because for anyone that has had the shingles, you never want it
You
again.
never want it again.
Right. So we have about 1 minute. Is there anything in summary or any closing remarks, or have we pretty much covered it all? I mean, I hope that our folks know enough to how to prevent it and when to go to the doctor and whatever. We've talked about that. And I guess we are pretty much out of time. So thank you so much for coming on board and helping us understand about the flu and the preventions and how to make ourselves better through it all. Thanks so much.
Thanks for having us.
Yeah, thanks so much for having us.